you've heard us talk about how much we love LDS Hospital, how great they are to their patients. Now Jim Sheets is here to tell us all about this incredible award. You guys actually were recognized for your patient care.
Yeah.
Tell us a little bit more about that.
Well, we were recognized nationally by a company called NRC Picker for their Dimension Award that was based on patient preference. And that means we really excel at when patients come into the hospital that we work with them, ensure our team works with them to make sure we're delivering the type of care they want, and then they can be a part of the care.
Well, I think it's so interesting that one of the areas that you really excel in is the women and, is it newborn services?
Yes, yeah.
Why are you guys so great at that?
Well, I think we've got a long history and reputation. You know, LDS Hospital's been open for 111 years. We've delivered a lot of babies,
Yep.
over 2,000 last year. And when a woman comes in, she has a choice and a preference, and it might be they might want to have a natural childbirth, they might want to have medicated, they might want to be with a midwife or an OBGYN, and we make sure we meet that preference and her needs and have it exactly as they would want it.
How early are people coming in to set these preferences? Are they going into labor and coming and saying, this is what I want, make it happen? Or are they coming ahead of time to plan it out with you?
It depends. Usually they plan it out ahead of time. They know what they want. They've either had a child at another hospital before in another setting, and they come in with a certain set of expectations. And so we work with them and make sure we're meeting those expectations and meeting their preference. But sometimes they might have moved here, they come in last minute, and they have certain desires, and we respond to those desires as well, whether it's they've been doing it for 6 months or it's 2 weeks.
I feel like nowadays things have been changing so much in what women are wanting, and it's even more diverse than it's been before. Have you guys noticed that at the hospital?
Oh, yeah, and we have a very diverse population, and it's interesting because some women only want their immediate family in the delivery room, and others want their cousins and aunts and uncles. We have very big labor and delivery rooms, and so we can meet both of those, and we ask them, what do you want, who do you want to be there, how do you want the aftercare to be? There's a lot of things that come in from whether it's breastfeeding or lactation specialists, and we try to do everything we can to make sure they're fully prepared that when they leave the hospital with that little bundle of joy that they're going to be able to take great care of it.
I feel like when I go into to have a baby, I'm so overwhelmed with so many things. It's an overwhelming experience. I think that's a really good superlative to use, is an overwhelming experience. Why is it so important to the patient for them to feel like they have a say in how it's going to go down?
Well, because this is an important thing, right? You're becoming a parent, and this is their family. They're starting their family, or they might be adding to their family, and we want to make sure that we're working with them so it's comfortable for them, because it can be an anxiety-ridden experience, right? It's not, you're nervous to come in, whether it's your first or your fifth, and to work with them and to ensure that we're treating them they want to be treated, so that when they walk home with that new addition to their family, they feel like they've had a great experience and that they're comforted and they have all the instructions they need to take care of that little one.
That is so wonderful, and it's so great to have a hospital having that approach, because I also felt going into this whole scary process of having a baby, because it can be scary sometimes, that I'm not the one in charge of what's going to be happening. So how do you change it at LDS Hospital so the patient knows that they are the boss of how things can go down and that they actually have a say?
That's really, really important to us in healthcare, because the patient is a person that knows their body better than anyone, right? They know what they want, they know what things to look for, and if they work as a team with the physician, with the midwife, with the nurses, and talk about their expectations, what they're feeling, what concerns they have, then we, in turn, can help them have a great experience and ensure that we're safe and that they feel welcome, that they feel at ease, and we're able to really deliver that care so that they feel like, wow, I feel good about this experience, and then I'll come back if I have my next baby.
Well, I am so impressed with LDS Hospital, because you were nationally recognized for doing just what you're saying you want to do. So congratulations on that.
Thank you.
Thank you so much for being here, Mr. Sheets. And
Thank you.
Please, if you want more information, go to ldshospital.org/healthyliving. You can hear all about all of the wonderful services they offer at LDS Hospital. And when we come back, we are going to be doing a preview. Big night tonight on Dancing with the Stars.
Shutters for Good Things Utah, provided by Wasatch Shutter Design.